But if I told you that one invisible virus brought the entire world to a standstill, or who you were, where you lived, or how powerful your country was, within weeks, empty streets replaced crowded cities, airports fell silent, hospitals reached their limits, and billions of people were told to stay inside their homes. For many, it was the most frightening chapter of their lives. Here's the question that still lingers years later. How did a microscopic virus manage to change the course of human history? Was the world truly prepared? What really happened during those first critical weeks? And what mistakes turned a local outbreak into a global pandemic? In this documentary, we'll follow the timeline, examine the evidence, and uncover the decisions that shaped one of the most significant public health crises of the 21st century. Some moments will surprise you. Some may completely change how you remember those early days. This isn't speculation. This is the documented story of COVID-19, the virus that changed the world forever. Let's begin. Chapter 1. The First Warning. December 2019. While millions of people around the world were preparing to celebrate the new year, doctors in the Chinese city of Wuhan were noticing something unusual. A small number of patients had developed a severe form of pneumonia. But there was one problem. The illness didn't match any known disease. At first, the cases seemed isolated. There was no reason to believe the world was about to change, or so everyone thought. Within days, hospitals began reporting more patients with the same mysterious symptoms: high fever, persistent cough, difficulty breathing. Doctors worked around the clock, searching for answers. Laboratories tested for influenza, SARS, MERS, and every other known respiratory virus. Nothing matched. Something new had appeared. As scientists rushed to identify the cause, health officials faced a difficult question. Was this a local medical mystery, or the beginning of something much bigger? No one knew the answer. Then came a discovery that changed everything. Researchers identified a previously unknown coronavirus. It would soon receive a name the entire world would remember: SARS-CoV-2. The disease it caused became known as COVID-19. At that moment, few people could have imagined what would happen next. The virus was no longer just a local concern. It had begun its journey beyond city borders, and the clock was already ticking. Chapter 2. The moment everything changed. At first, the world watched from a distance. The outbreak seemed like another regional health emergency, serious but contained. Life continued. Flights departed. Cities remained crowded. People celebrated the holidays. Few imagined that history was quietly changing. But behind the scenes, the numbers kept rising. Hospitals in Wuhan were treating more patients than ever before. Doctors were beginning to notice a disturbing pattern. This virus wasn't behaving like seasonal flu. It appeared capable of spreading from person to person, often before symptoms became obvious. That discovery changed everything. Then came January 2020. Scientists around the world raced to study the virus. Public health agencies began issuing alerts. Governments started asking difficult questions. How far had the virus already traveled? No one had a complete answer. And that uncertainty created something almost as dangerous as the virus itself: fear. Every new report raised more questions than answers. Every headline seemed more alarming than the last. Then, the virus crossed international borders. One country became 2. 2 became 10. Within weeks, dozens of nations confirmed their first cases. Airports introduced screenings. Travel advisories expanded. Health officials urged caution. Yet the virus kept moving. Silently, relentlessly. The world was entering a race against time. But there was one problem. Viruses don't wait for meetings, or political decisions, or perfect plans. They spread. And by the time many countries realized the scale of the threat, the outbreak was no longer just an outbreak. It was becoming a global crisis. What happened next would reshape healthcare, the global economy, education, and everyday life for billions of people. The world was about to hear a word that would define an entire generation: pandemic. Chapter 3. The day the world stopped. March 2020. There are moments in history when the world changes so quickly that people remember exactly where they were when it happened. This was one of those moments. One after another, countries began declaring national emergencies. Schools closed. Businesses shut their doors. Sports stadiums fell silent. Concerts were canceled. International travel was heavily restricted. For the first time in generations, billions of people were asked to stay home. The streets that once echoed with traffic became almost completely empty. Airports, once filled with thousands of travelers, looked like abandoned buildings. Entire cities seemed frozen in time. It felt like something out of a Hollywood disaster movie. Except this wasn't fiction. It was real. Hospitals were facing an unprecedented challenge. Doctors, nurses, and emergency workers worked exhausting shifts, often under immense pressure, trying to care for a rapidly growing number of patients. Around the clock, they fought to save lives. Behind every statistic was a human story: a mother, a father, a grandparent, a friend. Someone waiting for a phone call, hoping to hear good news. For many families, that call never came. As fear spread across the world, so did uncertainty. People rushed to grocery stores. Shelves emptied within hours. Items that had always been easy to find suddenly disappeared. No one knew, and how long the crisis would last. Then, another invisible battle began. Not inside hospitals, but online. Social media was flooded with rumors, unverified claims, and misinformation. For millions of people, it became difficult to separate facts from fiction. Scientists continued learning about the virus as new evidence emerged. Public health guidance also evolved over time to reflect that growing understanding. For many people, those changing recommendations created confusion, and confusion often creates fear. But while the world struggled to understand what was happening, something extraordinary was already beginning behind laboratory doors. Scientists across multiple countries were racing against time. Their mission was clear: develop a safe and effective vaccine before even more lives were lost. It was a race unlike anything modern medicine had ever attempted, and the outcome could determine the future of the entire world. Chapter 4: The Race Against Time. While the world remained locked inside homes, another battle was unfolding behind laboratory doors. It was a battle fought not with weapons, but with microscopes, genetic sequences, and sleepless nights. Scientists across the United States, Europe, and Asia were working with a single goal: create a vaccine before the virus could claim even more lives. Normally, vaccine development can take many years, sometimes more than a decade. But this time, the world did not have that luxury. Every week mattered, every day mattered, and every delay could mean thousands of additional deaths. Researchers began studying the virus at unprecedented speed. They mapped its genetic code, analyzed how it entered human cells, and tested multiple vaccine technologies simultaneously. Governments invested billions of dollars. Pharmaceutical companies formed partnerships. Regulators accelerated review processes while maintaining safety and effectiveness standards. What usually happened step by step was now happening in parallel. Then came an unexpected breakthrough. A technology that had never before produced a widely used human vaccine moved to the center of the fight: mRNA vaccines. For years, many people outside the scientific community had barely heard of mRNA. Suddenly, it became one of the most discussed terms on Earth. The idea sounded almost futuristic. Instead of using a weakened virus, the vaccine would deliver instructions that taught the body how to recognize a harmless piece of the coronavirus, allowing the immune system to prepare a defense. But there was a problem. The faster the development moved, the more questions the public began asking. Could a vaccine created so quickly be trusted? What were the risks? How thoroughly had it been tested? These questions were debated everywhere. On television, online, and around family dinner tables. For some people, the vaccines represented hope. For others, they represented uncertainty. It was one of the most intense public discussions about science in modern history. Then, in late 2020, the results from large clinical trials arrived. The data showed that several vaccines were highly effective at reducing severe illness and hospitalization. Within weeks, countries began authorizing emergency use. The first vaccinations were administered to healthcare workers, elderly citizens, and other high-risk groups. For the first time in months, many people felt something they had not felt for a very long time: hope. But the story was far from over. Just as vaccination campaigns were beginning, the virus revealed another twist. It was changing. New variants were emerging, each raising fresh questions about transmissibility, immunity, and the future of the pandemic. The world had won an important battle, but the war against COVID-19 was entering a new phase. Chapter 5. The virus evolves. Just when the world believed the worst might soon be over, the virus delivered another surprise. It was changing. Like many viruses, SARS-CoV-2 continued to mutate as it spread. Most mutations made little difference, but every now and then, one changed the course of the pandemic. Late in 2020, scientists identified new variants that appeared to spread more efficiently than earlier versions. It was a stark reminder. This pandemic was still evolving. Every new variant raised urgent questions. Would existing vaccines continue to provide protection? Would hospitals once again face overwhelming pressure? Could the world return to normal? Or was another wave already beginning? Researchers rushed back to their laboratories. Public health experts intensified surveillance. Countries expanded genomic sequencing to track how the virus was changing. Around the world, scientists were watching the same invisible enemy, almost in real time. Then, another challenge emerged: pandemic fatigue. After months of restrictions, many people were exhausted. Families had been separated. Businesses had struggled. Students had spent months learning from home. Healthcare workers had endured relentless pressure. Everyone wanted one thing: their lives back. But viruses don't negotiate with human impatience. In many places, lifting restrictions too quickly was followed by new surges in infections. It became a difficult balancing act. Protect public health while allowing society to recover. There was no perfect answer. Every country faced difficult decisions. Every decision carried consequences. Yet, amid all the uncertainty, there was one remarkable achievement that stood out. Scientists from different countries, medical professionals, public health agencies, and countless volunteers had collaborated on an unprecedented scale. The pandemic exposed weaknesses in global preparedness, but it also revealed what humanity could accomplish when knowledge, research, and cooperation moved at extraordinary speed. As the years passed, the emergency phase gradually came to an end. Airports became crowded again. Schools reopened. Cities came back to life. The masks slowly disappeared from many public spaces. The silence that had once defined the pandemic was replaced by the sound of everyday life. But history had already been rewritten. COVID-19 was no longer just a news headline. It had become one of the defining events of the 21st century. And perhaps its greatest legacy wasn't only the lives it changed, it was the lesson it left behind. A lesson the world cannot afford to forget. Today, the streets are full again. Airplanes fill the skies. Schools are open. Stadiums roar with cheering crowds. For many people, life feels normal once more. But beneath that normality, the world is not the same. COVID-19 did more than infect millions of people. It changed how humanity thinks about disease, science, public health, and global cooperation. It reminded us that in an interconnected world, an outbreak in one city can become a challenge for every nation. The pandemic exposed weaknesses. Healthcare systems were tested. Supply chains were disrupted. Economies slowed. Families were separated. And millions of lives were forever changed. Yet, amid the tragedy, there were extraordinary stories of courage. Doctors who worked until exhaustion. Nurses who stayed beside patients when families could not. Scientists who collaborated across borders. Essential workers who kept societies running. And ordinary people who made extraordinary sacrifices to protect others. History often remembers wars, revolutions, and great inventions. But future generations will also remember this pandemic, not because humanity was powerless, but because it revealed both our vulnerabilities and our resilience. Even today, scientists continue studying COVID-19. They monitor new variants. They improve vaccines and treatments. And they use the lessons learned to prepare for future outbreaks. Because the next global health emergency, whenever it comes, will test whether we truly learned from this one. So, Was COVID-19 just another chapter in history? Or was it a warning that the world cannot afford to ignore? That answer belongs to all of us, because the next pandemic may not begin with headlines. It may begin with a single patient, in a single city, on an ordinary day. And history has already shown us how quickly an ordinary day can change the entire world. If this documentary helped you understand one of the most defining events of our time, consider sharing it with someone who should never forget these lessons. Because remembering the past may be the best way to protect the future. Thank you for watching.